Hey, San Diego, it's Dr. Shumard here with Integrative Wellness Center. And today I want to continue our conversation on type 2 diabetes and how you can actually reverse your type 2 diabetes. So, before we get started, I just want to review something that we spoke about last time, which is the gastrointestinal area and the impacts that it has on your diabetes and your ability to regulate blood sugar. Many individuals don't realize how important the GI is important to blood sugar and diabetes. Oftentimes, it's just glanced over or no one's really analyzing it. And one of the things we talked about last time was how infection patterns like bacterial infection patterns, parasites, yeast, fungus, and other types of infection patterns that may occur inside the gut and that can lead to things like leaky gut disease. Well, today, what I want to discuss is something a little bit different as we continue on this path of understanding diabetes. And we're going to talk about a hidden gland that many people may have never heard of. Many people have no idea what it is or what it really does, even though some of the things that happen in our body, or many things that happen in our body, rely on this gland and the importance of the gland. Because of this information I'm going to talk about today, and this gland is so important to the body, I'm probably going to break up the topic into two, maybe three different parts. So I'm going to talk about a few things today because this video can get pretty long when you're discussing the importance of what it does. And so this gland is called the adrenal gland. Now, if you've never heard of this gland before, which many people have not, this gland sits on top of your kidneys. It's also referred to as your stress gland. So when your body is under stress, that may be a physical stress, a mental stress, or a chemical stress. Most of us think about our physical stressors, right? So the person who cuts us off on the freeway, or losing a job, or losing a loved one, or financial stressors. The financial stress, these are all physical, emotional type stressors, right? They affect us emotionally. Physical stressors is going to be more of like exercise, activity, and injury. Running, jumping, lifting weights. Those are physical traumas, or like you could have a car accident, something like that. Those are physical stressors. And chemical stressors are going to be more of your, what do you eat? Is there chemicals in your food? Are you eating organic? What kind of water do you drink? What are the things inside your water? Are you having filtered water, or are you just drinking out of the tap? What type of types of foods, right? Are you eating more fast food, or are you eating more quality food that you're cooking? So these are types of things that are going to be more of a chemical stressor. Pharmaceutical drugs can be a chemical stressor, illicit drugs, alcohol, those sort of things. But most of us really think about stress as being an emotional stress, which obviously can impact our body, but we forget about these physical and chemical stressors as well. But these stressors play a role on our adrenal gland. And one of the hormones that it produces is called cortisol. Now, some of you have probably heard of cortisol because you've heard of how it increases weight gain in the belly area, and it can cause difficulty of losing that type of weight. But you may not realize that cortisol is also important hormone for regulation of stress. So when your body is under stress, cortisol helps reduce that stressful response and help out that whole concept. So when your body and your brain is telling your adrenal gland to produce these hormones to mitigate that stressful environment inside your body. So over time, long term of that type of response can cause a lot of problems inside the body, including eventually reducing the ability for regulation of blood sugars. What maybe some of you don't know is that the adrenal gland is heavily involved in blood sugar regulation. It's one of its most important jobs. When the liver, pancreas, and the adrenal gland are working together to constantly regulate blood sugar during times when you're eating and during times when you're not eating. And if your adrenal gland is not functioning optimally, I'm not saying that it's in a disease state or something like that, but if it's not functioning optimally, it could be one of the underlying reasons of why you can no longer regulate your blood sugars. I mean, think about it. Those of you right now that are dealing with diabetes, or you know someone in your family or in your life that's dealing with diabetes, think about and ask the question, has your doctor ever analyzed the adrenal gland? And if I ask that question to, if you were in the room right now listening to me, or if many of you are in the room listening to me right now, most of you, if any of you, would say, no. I mean, I have not had my adrenal gland analyzed. I didn't even know what it was. I never heard about it before and how it can influence my diabetic condition. So we have a gland, and one of its major jobs is to regulate blood sugar, but it's not being analyzed. That's a problem, right? So, and it goes back to the common theme that I constantly talk about in these videos, is that in the drug therapy model and the traditional medical model, the treatment of choice is drugs, pharmaceuticals, to manage the diabetic condition, to help lower blood sugars, to modulate your ability to regulate your blood sugars, and to forcibly make your body reduce those blood sugars, not to help find out what the problem is. What is the underlying cause? Why are you not able to regulate blood sugar on your own any longer? So when you're not running the proper testing, the analysis, you're going to miss a lot of these things. Now, analyzing the adrenal gland is very easy, right? There's two different tests that we use in our office, depending on the patient, depending on the situation. One of them is a saliva test which is a ability to analyze your hormones, not only your female and male hormones, but also your ability to measure cortisol levels. We can then measure your cortisol levels to determine, is your adrenal gland responding appropriately, or is it not responding appropriately? And that can tell us the functionality of your adrenal gland. Just like if you took your car to a mechanic and they hooked up to a diagnostic machine, and they can see if your car is functioning properly or it's not, and what areas is your car not functioning properly, and where does it need help or to be repaired. The body is no different, right? If you're not looking at the body appropriately, you're going to miss a lot of things, and then the only option is to address the symptoms, just like the traditional treatment is in diabetes currently today. This is some of the things that I talk about in my book here, How to Reverse Your Diabetes, is that we talk about the different organs that are involved, and the adrenal gland being one of the most important ones that should be analyzed. So there's another test that can be ran, which is done through urine, which is going to measure the metabolites, so your ability to not only produce cortisol in your body to use cortisol, but how is it using cortisol inside the system as well. So we not only can look at how much cortisol your tissues are using, like we do on the saliva test, but we can see how much your body is using and how much it's utilizing and how it's being done inside your body. Is it being stored in tissues because your body's not able to handle and use it appropriately? Or is it utilizing it appropriately so it gets a little bit more specific in the